In today's video, I want to talk about hunger, especially the deeply personal sensations of hunger that we use to choose whether we eat or not in any given moment. My name is John Pilcher. I'm a bariatric surgeon in San Antonio, and when I'm talking to my patients after bariatric surgery, I want them to understand and to explore their hunger so that they can use their hunger level to choose whether to eat or whether not to eat and when to stop eating, and hopefully use their hunger as well to make healthy food choices that will give them sustainable energy and lasting health. Now, usually we use shorthand when we're talking about hunger. We talk about hunger as a simple thing, a simple word. We say hunger, yes or no. We talk about this satiety, which is a sensation of satisfaction once hunger is gone. And we sometimes try to put hunger on scales, 1 through 5 or 1 through 10. But it can be much more complicated than that. And I think that for each individual to understand and to explore their own hunger sensations is going to be very useful so that they can make the most effective and the most healthy food choices over time. Now let's back up just for a second. Before bariatric surgery, when a person is in the grip of the obesity disease and when the hunger hormones and the energy hormones are out of balance, we can't trust the hunger level. The hunger level is actually driving them to eat at times that don't make sense. The hunger can be a sensation that is vicious or a hangry or an aggressive hunger, a distracting hunger that makes a person eat whether it makes sense in that moment or not. And the way we understand that, certainly the way I understand that, is that that is just a manifestation of the obesity disease that drives the excess fat storage. Hopefully, after bariatric surgery, and this should be true of the gastric bypass or the gastric sleeve, hopefully after bariatric surgery, the hunger is different. Hopefully the hunger makes sense. Hopefully it is a healthy hunger. Hopefully it's an infrequent hunger, and it's a hunger that mostly points a person towards healthy food intake. But we can't take that for granted, and so we're going to explore this a little bit more through the course of this video. Obviously, hunger can be a physical sensation. Maybe it comes from the belly, maybe it comes from other parts of the body. But I think if we explore further, we understand that hunger can be a set of thoughts, it can be a social, cultural interest in food, it can be emotions, and it can be a variety of other factors that lead to, let's just call it food interest. And we should also recognize that the factors that lead to this single sensation that we call hunger vary over time, and there can be multiple factors at play at one time. And so, and these are very individual sensations, so it's going to be something that a person needs to learn their own patterns and explore internally. I wish we had a larger vocabulary instead of this one single word of hunger. And I've already started a little bit, food interest. I'll use the word cravings in a minute. But the Inuit who live in the Arctic are said to have more than 20 words that talk about various forms of snow and ice. And it seems to be the case that for the Inuit to be accurate about their environment and these different forms of snow and ice probably allows them to live in a more effective and a more survivable way. I think in a similar way that if each of us as individuals, especially people after bariatric surgery, explore their own hunger sensations and reflect and come to understand these hunger sensations, that they will be able to respond to the hunger in a way that's more healthy and sustainable for them over the long run. Now, I'm not ready to create a whole new vocabulary of hunger like the Inuit have for snow and ice, but I'm going to walk through some examples of hunger types that I've observed in my own life and I've observed from talking to my patients, and then we're going to put these types to use in some scenarios with my suggestions about what those scenarios of hunger might mean and what I think is probably the most healthy and most sustainable way to respond to these different hunger settings. And as I lead into a description of some different hunger types, I want you to keep in mind some points that I mentioned already. First of all, most people have a variety of hunger sensations mixed together at one time, so it's unlikely you're going to find one of these things cleanly. And then also, hunger is a very personal experience, and it's an internal experience. And so my best advice for everyone watching this video who's interested is to just try to be observant or sensitive to your internal sensations. Notice how you feel before you eat. Please be conscious and pay attention to how you feel while you are eating, and pay attention to how you feel after you eat. And it's only through this, in cycles of days and weeks and months, perhaps years, and repeated reflection, that you will really learn your own physical sensations. And again, how to use the environment and to use food as a healthy fuel for your body that gives you lasting energy, lasting satisfaction, and lasting health. Now, the first type of hunger I have in mind, I will describe it as a physical hunger that makes sense. It's a pretty awkward term, right? And I think this is the type of hunger that most people have in mind when we use this one simple word, hunger. And when I say it's a physical hunger that comes on because you haven't eaten in a while. And it's a hunger that comes on gradually. It seems to come from the body. It tends not to be terribly distracting unless you let it go for a very long period of time. But instead, this type of physical hunger that makes sense tends to increase interest in food. And it may lead to some thoughts of food along the lines of, man, some spicy shrimp would sound really good right now. And it tends to point a person towards food types that are healthy, which we think of as being the proteins, the green vegetables, the natural fats, the spices, etc. But it's easy to set this physical healthy hunger aside if you're occupied with something else, and it will lead to just an appeal of food and enjoyment of food when you do sit down to eat. Also, this physical hunger that makes sense is fairly easy to satisfy with a moderate, appropriate amount of healthy food. A second type of hunger that I think it's useful to recognize is a social cultural interest in food. And in society, this may be dismissed or may be thought ill of, but I think that food does have valid cultural and social significance. Back in caveman days, sharing food was a matter of survival. In today's world, sharing food does have valid relationship building, or it may even connote love. And so I think that social cultural interest in food can be an appropriate reason for eating. I think it's useful to understand that's why you're eating, as distinguished from this physical hunger that makes sense that I mentioned first. Moving from a couple of hunger types that seem positive and healthy to me into several hunger types that seem probably counterproductive, hunger types to be observed for and guarded against. The first of these is what I'm going to call marketing hunger. And here in the West, the food industry wants you to eat more. They want to sell more of their product. And so there is marketing all over the place suggesting that with a certain type of food, and certainly more of that food, you're going to be more energetic, more sexy, more appealing, more connected. And it's especially prevalent these days that more protein is going to lead to more health. You've probably heard me say in other contexts that I love protein. I think protein is great, but I think extra protein is just extra calories. And so just be observant for this marketing hunger. We're in football season as I'm recording this, so the pizza commercials are all over TV. Perfect example, and watch out for those things. The next hunger type that I think may be counterproductive is habitual hunger. And it's natural. Humans are creatures of habit unless we're conscious about what we're doing. And so it's natural and expected that we will become hungry and feel hungry just because it's time to eat. And I don't think it's terrible to have certain habits, because habits can be good as well. But I'm just going to encourage you as much as you can to, on a daily basis, to be observant of your actual hunger level. What type of hunger is this? And, and don't feel like you have to eat just because it's time to eat. Another type of hunger that probably already came to mind for you is emotional hunger. Now, it's true that sadness or anxiety or boredom can lead to eating behaviors. And it's also true that some foods, classically sugars and fats, can change a person's physical sensations in a way that may treat a certain emotional state. I think this may be overplayed, actually. And I think that many times what is viewed as or perceived as emotional hunger may in fact be a different physical type of hunger, an unhealthy type of hunger that I'm going to call cravings. That cravings actually can lead to alterations in thoughts and emotions, and so that's why there can be this misunderstanding. But I'm going to talk about cravings in detail next. Craving is a word that I often use in my discussions with patients to mean a physical hunger that does not make sense. And it's similar to that earlier healthy hunger that we discussed in the sense that, yes, it's physical and it's powerful, but craving is an unhealthy hunger that does not make sense in that moment. And how craving feels, a craving hunger is much more insistent, it's much more intrusive, it's more bothersome. And my understanding is that where craving comes from is usually a deficiency of something. Most often that deficiency is a deficiency of blood sugar. And we'll talk about blood sugar fluctuations in just a moment, but very often a craving comes from having a low blood sugar in that moment. A craving might also come from a deficiency of vitamins. Or a different way of having a craving that's not a deficiency is that many medications that are commonly used also leads to physical sensations of hunger that don't make sense. Now, I keep talking about a craving as being a physical sensation that affects the thoughts and affects the emotions. And what turns out to be true is that when the energy hormones get out of balance in the setting of a craving, interestingly, also in the setting of the obesity disease before surgery, when the energy hormones get out of balance, they provide feedback to the mind and to the brain through the primitive part of the spinal cord, what's often called the reptile brain or the hind brain. And this is the part of the brain that's responsible for survival. And so when the survival brain, the reptile brain, gets signals that we're short on energy and we're short on sugar or we're short on vitamins and we're short on something, we don't know what it is, but we need food right now, well, then that craving hunger sensation is very hard to get away from. I'm going to outline my hunger scenarios as they kind of progress through time for bariatric surgical patients. And so before bariatric surgery, first of all, there's this out of balance hunger sensation in the grip of the obesity disease. And as I mentioned already, this hunger very often is a craving hunger. It is a physical hunger. It's often a hunger that doesn't make sense. And society will put this on habit or emotion or just marketing. And like I said, those factors can come into it. But people who have the obesity disease have a physical hunger that does not make sense, that arises when there's not an actual physical need for calories or fuel, and that yet drives them in a pretty powerful way to take in more calories. So we should understand that this hunger hormonal imbalance is the key reason for undertaking a hormonal metabolic intervention, which is bariatric surgery. My second scenario for discussion is the recovery period right after bariatric surgery. And typically the patient experience at that time is, what is hunger? It's kind of cool, and it's also kind of weird. And over the first couple of weeks after surgery, most patients do regain gradually a small, quiet, subtle sense of physical hunger. And it's tricky, so I just want you to know that if you're living with this, it's kind of expected to be a little bit difficult to tell, and whether you're hungry or not. And so my first advice to patients is that if you think you might be hungry, try drinking some water first, or whatever you're using for your hydration, and if that sensation goes away, that's awesome. That means you do not have to eat at that time. But if you hydrate and you still have the sense of maybe it's emptiness, maybe it's a food interest, then that probably is real hunger, and it's probably appropriate to nibble on a little bit of healthy food at that time. And you'll get detailed instruction about eating very gradually and slowly and carefully. I'm not going to go into that here. Another thing that often happens at this stage, again, it's mixed for people in different stages, is not just this physical sensation of hunger, but there's kind of a curiosity about food, or just being done with the liquid diet in the recovery phase after surgery. And I'm okay with trying out some food at that point also. I just would stay with the idea that I want you to be observant of your body, to be careful to make note of your physical sensations, not only leading into that episode of eating, but how does it feel during eating? How does it taste? How do you feel afterwards? And this is the beginning of being very conscious with your eating for the rest of your life, in a way that will help you recognize what your hunger type is and how best in a most healthy way to handle that hunger in that moment. The next natural phase for bariatric surgical patients over months and years after surgery is to have some physical hunger that makes sense once, twice, maybe 3 times a day. And although most people do fall into a fairly predictable pattern, that's still going to vary a little bit according to the person and according to their activity level. And of course, my advice when it seems like a healthy hunger, when it's easy to satisfy, is to eat some natural healthy food. And this is really our optimal outcome. One different scenario after bariatric surgery is hunger that may occur after workouts. And to have some level of hunger after workouts is probably appropriate. You're drawing down your body's fuel stores. And so if you feel hungry, it's probably appropriate to eat. I'm not a fan of pre-workout and especially amino acid chemical preparations and these kinds of things. But, you know, a little bit of string cheese or nuts or some pepperoni or something like this, just natural healthy foods after a workout if you're hungry does seem to make sense. Now, if you're going through a very intense workout, especially high intensity cardio workouts, you may have a very intense hunger after your workout that we would call a craving, which means it's hard to ignore and it's powerful. And this probably means that your body is overutilizing or tapping out its energy stores. And it's not harmful exactly, but it can lead to bad eating behaviors in the long run. So if you're experiencing very intense hunger after an intense cardio workout, it's a balance. I know the cardio workouts can be great, but I would probably suggest just backing off on the cardio intensity just a bit so that your body can burn fuel in a way that it keeps up with the workout instead of going deep into its short-term energy stores. Now, a very common scenario that's not such a good thing in the long run after bariatric surgery is the mid-morning drive me crazy hunger. I've got to have something at 10 o'clock or 11 o'clock, and a lot of people are at the office, or these days they're working from home, and there may be some stuff around that's a snack food that you tend to go to. So this mid-morning drive me crazy hunger can turn into a real practical problem with excess calorie intake and calories that are of the wrong type. And so in my experience, when people have this common mid-morning hunger, it is actually, and as I mentioned with cravings a little while ago, it may be coming from something being low or out of balance, and most commonly it's the blood sugar. And so very commonly over time, even people that are trying to do the right thing will gradually slide into having some carbs around the beginning of their day. Common carbs go with breakfast. It could be toast, it could be oatmeal. Oatmeal's not that great. Any kind of cereal is a carb. Tortillas with your tacos, especially if you're here in South Texas where I am. And here's the one that people often don't know about, is the stuff that they put in their coffee. So you may think you're not having anything to eat, but you put lots of this non-dairy creamer into your coffee. And the non-dairy creamer is pretty much going to go straight to sugar inside your body. Look at the label. I'm making another video on this, but the stuff that we put in our coffee often causes the blood sugar to spike up and then several hours later to crash down. So that, along potentially with your breakfast carbs, can be a source of a mid-morning craving. What to do about this? So I'm not against coffee. You can use actual dairy creamer, half and half or heavy cream. If you're hungry in the morning, and remember, I'm not going to advocate eating breakfast if you don't feel hungry, but if you feel hungry in the morning, I know that it may be a bit too much to prepare eggs and bacon and ham and clean up because most people are getting out of the house, but instead, you might try some healthy snack foods. Again, string cheese, nuts, pepperoni, some fresh deli meat or something along those lines might be healthy ways of getting something to eat in the morning without, throwing your body into a balance and still meeting the convenience factor. The last kind of scenario or category I'm going to discuss is pretty challenging, and this is a small subset of bariatric patients where my hunger never went away after my surgery. And I've seen this where patients, and it's a very small subset, runs 2% or something like that. Patients are doing the right thing, eating the right things, have the right vitamin levels, and they still genuinely have hunger that doesn't make sense. It's coming from a physical thing, and it's difficult to control. And they will lose weight, but they are at very significant risk of weight regain over time because the hunger is still out of balance in comparison to their body needs. And this, honestly, I think represents a lack of complete understanding that we in the medical profession, we bariatric surgeons, we medical physicians have. We don't fully understand hunger, and I think that the hormone imbalance, the energy hormone imbalance that happens in the obesity condition is probably different among different people. So some people are full responders to gastric bypass or sleeve. Other people are partial responders to gastric bypass or sleeve. By the way, this happens a little more often with sleeve than with gastric bypass, but either way, if you seem to be someone who's a partial responder, we really want to have you more intensively connected with your bariatric team. First of all, the bariatric team is going to work to troubleshoot the common causes of physical craving, which is, the wrong types of food, the carbs, the chemicals, and they're going to look for deficiencies. They're going to look for medications that may be stimulating hunger. But if none of these things is found, then the good news is that there is a growing and a more effective set of tools from a medical perspective that can actually help get the metabolism into a better balance and get that hunger under better control. In closing, I'm just going to circle back to the beginning concept that hunger is complex and hunger is personal. So I think the best that each of us can do is to be conscious of our physical sensations and how our body interacts with food. And this is true whether you're struggling with obesity today and you have not had surgery, or whether you've had surgery 2 weeks ago or 10 years ago. That's number one. Number two, give yourself some grace, because also, no matter where you are in the process, this is a process in your body. No one is perfect, but in concert with your bariatric team, we are happy to help you keep getting better and better.